Do I always need to offer an explanation when I give a diagnosis? In my case, I'm Dr. Arora from Arora Medical Education. I get asked this question a lot. I do a lot of role play practice with people doing PLAB 2 and RCA and CSA and these kind of exams. And often when it comes to the post-examination part where you're talking about diagnosis, differential, etc., we often get this thing happening where people give a diagnosis like, I don't know, tennis elbow or osteoarthritis or migraine. And then they go on to sometimes give a 2 or 3 minute, sometimes very lengthy, very wordy, very complex explanation of a condition. And I get why people do this, because we think that, well, patients need to understand what the condition is that we're diagnosing, and that's all fine. But sometimes it takes a lot of time in the consultation, and sometimes actually there are no marks for it. Sometimes there's no need for it. Sometimes the patient already actually knows what a migraine is. They've done a lot of research on it. Sometimes they may know a certain amount and they just want to know a little bit more, but we go and do the whole man again. So this video is all about what we talk about in terms of the diagnosis, and not jumping straight into an explanation, but the importance of offering an explanation. There's a big difference. So whenever we talk about setting up the management plan, we talk about diagnosis, explanation, issues on the table. If you've watched our videos, you'll know exactly what we mean about how to set up a management plan. But the second point is really important. It's not diagnosis, explain, issues on the table. It's diagnosis, offer explanation, issues on the table. Now, why offer an explanation? Like I said, sometimes people don't actually want to know what the condition is. They want to get on to how do I treat it. Sometimes people already know what a condition is. They want to get on to how do I treat it? What can I do about it? And sometimes we lose a very important 1 or 2 minutes. And not just the time that gets lost. Obviously, you lose time by doing this, but it can actually trigger off other questions and other conversations that you get bogged down in. So if you start giving an explanation about migraine and you mention a term that the patient doesn't quite understand, they're going to ask you about that. Sorry, what did you mean by that again, doctor? What was that part again? And you get bogged down in this part of the conversation, and maybe there's no marks in this, maybe there's no need to do this, but you're stuck now because you have to answer the questions that have been put, and those questions have come based on the explanation that you were doing and may not needed to have been doing. So offer explanation is really important. So Mrs. X, you've got something called a migraine, because that's something that you've heard of. Do you want me to explain that a little bit more? Yeah, doctor, please, if you go through a bit of detail, that'd be great. There's the bit that you now start talking about migraine, because there are marks there, or there's actually a lack of understanding that you need to help close down. However, you may say, Mrs. X, you've got something called a migraine. You may have come across this. Is that something that you've heard of? Do you want me to explain that in more detail? No, doctor, I've done a lot of reading about migraine. I've had them for years. I know exactly what they are. Do you mind just telling me what I can do? How can I stop them happening? And you jump straight into the next part, maybe talking about prophylaxis or treatment or whatever it might be. But you see how you might be able to save yourself 2 or 3 really important minutes. And I've seen this so often where people just get lost and 1 or 2 minutes goes by and you only have 2 or 3 minutes anyway, and then before you know it, you're stressing because you haven't started talking about the actual management plan yet. You're stuck in the explanation. And it's just because sometimes people tell you must explain a diagnosis. That is not true, okay? But you must offer an explanation. That bit's really important. Mr. X, you've got something called knee osteoarthritis. Looking at the x-ray here, is that something that you've heard of? Do you want me to explain that in a bit of detail? No, doctor, it's okay. A lot of my family have got arthritis. I'm okay, but how am I going to help? How am I going to deal with this pain? Or Mr. X, you've got something called osteoarthritis. That's what the x-ray is showing. Is that something that you've come across? Do you want me to go through that in a bit of detail? Yeah, actually, doctor, I've heard about arthritis and osteoarthritis, but I'm not quite sure, what it's all about. Do you mind just going through it in a bit of detail? Okay, now it looks like there's a bit of marks there, or there's a deficit of knowledge that I need to fill before we can go on to talk about treatment in a patient-centered manner. So if you're doing role plays for things like PLAB 2, RCA, CSA, other role play based exams, please don't feel that you need to always explain explanations in your management plan, but please do remember to always offer an explanation. And it's amazing how many times you can buy yourself a vital 2 or 3 minutes in that second half that you can spend really wisely, hopefully scoring a lot of marks in the management plan. We've got loads more videos like this on the YouTube channel. Please do subscribe, like, share if you found this of some value. Please use the coupon AroraVideo10, ARORAVIDEO10 if you want 10% off any of our courses, whether it is our live courses, our mock exams, our audiobooks, our online courses, our flashcards, or anything else that you find on the website aroramedicaleducation.co.uk. I hope you have a super day. Please remember, you don't always need to explain diagnoses, but you do need to offer an explanation. #CanPassWillPass. Hashtag I went with Arora. Have an amazing day.